How was your class today?
Not good. I don't understand anything. I mean, what even is cortisol and why do you have to worry about it in the first place?
Now let me tell you a little story.
Doctor, we have to see this patient.
Hello, my name is Dr. Cushing and I'm here to examine you. Why have you covered your face? Could you please remove it so that I can examine you?
I cannot face the public. I am tormented every day by the malicious comments they give on my body. Obese, fat, greedy, what not they call me, and this nuisance of the world.
Your symptoms seem to strike something in the back of my mind. You need not worry, you're not alone in this. Nurse, could you please take the blood sample and give it to the lab?
While he was waiting for Minnie's test results, Dr. Cushing saw a number of patients in the ward with symptoms similar to Minnie. Minnie's results came in showing elevated levels of cortisol. At that point, Dr. Cushing was very sure about the connection of the case to the adrenal gland because many patients who passed away with these symptoms were presented with a tumor in the adrenal gland. Later that evening, Dr. Cushing came across a picture of Percy Sargent in a newspaper. He successfully removed a patient's adrenal tumor, which resulted in the disappearance of the patient's symptoms, which were similar to Cushing's cases. On the contrary, in 1931, a patient with similar symptoms was diagnosed with an adrenal tumor. However, during surgery, no adrenal tumor was found. The patient later died, and the diagnosis was changed to hyperfunction of the adrenal system without any anatomical basis during the postmortem. Months later, Dr. Cushing advised Dr. Bauer to take a look at the pituitary. Dr. Bauer found a pituitary tumor, which upon histological study was found to be a basophilic adenoma. Dr. Harvey Cushing published an article in 1932 in which he changed his opinion and said if acromegaly was due to acidophil hypopituitarism, there was another form due to excess of basophil cells. Later on, a book called A Case of Basophil Adenoma of the Anterior Lobe of the Pituitary, Cushing Syndrome, was published. This was when the name Cushing Syndrome was established for this set of symptoms corresponding to the case being adenoma.
Alright, Grandpa, I finally get the pertinence of the cortisol, but why did these symptoms occur in many of the other patients in the first place?
Now that is for you to find out.
Cortisol is a type of glucocorticoid which is a steroid hormone. It is synthesized from cholesterol and is secreted from the adrenal gland. The adrenal gland, which is situated on top of the kidney, has a cortex and a medulla. The cortex is in turn divided into three parts: zona glomerulosa, zona fasciculata, and zona reticularis. The zona glomerulosa secretes mineralocorticoids, which include aldosterone and deoxycorticosterone. The zona fasciculata secretes glucocorticoids, which include cortisol and corticosterone. The zona reticularis secretes adrenal androgens, which include dihydroepiandrosterone and androstenedione. Cortisol, being a steroid hormone, has its receptors in the cytoplasm. Now let's move on to the functions of cortisol. Cortisol has both metabolic and non-metabolic functions. Let us take a look at the metabolic functions. First, we will see the effect of cortisol on carbohydrates. Cortisol has an anti-insulin effect. It acts on the liver and promotes gluconeogenesis and inhibits the peripheral utilization of glucose by the cells, thereby increasing blood sugar. In protein metabolism, cortisol facilitates proteolysis and inhibits protein synthesis, thereby increasing the level of proteins in plasma. In fat metabolism, it increases the metabolism of fatty acids from adipose tissue, thereby increasing the free fatty acid in plasma and also increases the oxidation of fat. Now let's move on to the non-metabolic functions of cortisol. Effects on cardiovascular system include increased myocardial activity of heart and maintenance of vascular reactivity of blood vessels. In the CNS, this hormone is required for normal functioning. Decrease in the level of this hormone leads to irritability, inability to concentrate, increased sensitivity to taste and smell, and personality changes. In kidney, it increases the glomerular filtration rate, prevents water intoxication, and inhibits ADH. In connective tissue, it inhibits collagen synthesis, thereby decreasing the skin thickness and causes thinning of capillary walls. In fetus, cortisol causes lung development. It promotes the growth of alveoli and causes flattening of alveolar epithelial cells. It also facilitates pulmonary surfactant synthesis. All these actions allow the fetal lung to satisfactorily expand at the first breath. Effects of cortisol on bones include increased resorption of bone matrix, calcium resorption, and inhibition of bone formation. Now let us look at its anti-inflammatory action. This is achieved through the following steps. Cortisol stabilizes lysosomal membranes. It decreases permeability of the capillaries. It reduces the migration of WBCs into the inflamed area. It decreases phagocytosis of the damaged cells. It also suppresses the immune system, causing lymphocyte production to decrease. Ultimately, the inflammation is brought down. Next, we have the effect of cortisol on blood cells and lymphoid organs. It decreases the number of eosinophils, basophils, and lymphocytes. It increases the number of RBCs, platelets, and neutrophils. It also has a function to resist stress. It stimulates the anterior pituitary to secrete ACTH, which in turn stimulates the adrenal medulla to secrete catecholamines. Cortisol increases vascular reactivity to catecholamines, which decreases stress and increases the lipolytic activity of catecholamines. The last action, which is a very important action, is the anti-allergic effect. Cortisol prevents the release of histamine from mast cells. As we have learned about the functions of cortisol, we should also learn about their disorders. Hyposecretion occurs in Addison's disease, which is an overall decrease in the functional activity of the adrenal cortex. Hypersecretion, however, results in Cushing syndrome. Cushing syndrome refers to all causes of cortisol excess, whereas Cushing's disease refers to the disease that occurs only due to the ACTH-producing tumor of the pituitary gland. Features of Cushing syndrome include centripetal obesity, overweight and buffalo hump due to peculiar distribution of body fat in which fat is deposited more in abdomen and upper back. Moon face appearance, where the face becomes round with red cheeks due to fat deposition. Weakness due to wasting of muscles and decrease in peripheral utilization of glucose. Centripetal obesity and peripheral muscle wasting, which present as lemon on toothpicks appearance. Water accumulation and direct action of cortisol on blood vessels causing hypertension. Excess fat deposition in the abdomen causes rapid stretching of skin. Collagen secretion is compromised, therefore resulting in formation of reddish-purple stria. Thinning of skin and subcutaneous tissue as a result of protein catabolism, due to which the capillaries of the skin become thin and fragile, and thus any minor injury causes severe bruising. Hyperglycemia and glucose intolerance. Hirsutism and amenorrhea in females due to associated increase in adrenal androgens. Poor wound healing due to hyperglycemia, which promotes growth of organisms at the wound site. Osteoporosis due to decreased bone mineralization and decreased bone mass.